A year ago, we discovered ourselves in a pandemic. It started from Wuhan in China, and it didn't take too long until a huge number of countries in the world were in some sort of lockdown. 1 year has passed, and COVID-19 is still very much shaping our everyday realities. This is state of emergency 1 year later.
Early last spring, I decided to do a short, small video series about the COVID spread here in Estonia. We've always considered ourselves to be this small, quiet corner of Europe where nothing much really happens. No hurricanes, no earthquakes, no tsunamis, and definitely no viruses from Southeast Asia. So it's safe to say we weren't really prepared for COVID last spring, but then again, who was? And if you take all things into consideration, we managed to get through the first wave quite successfully, I would say. So there was like this level of pride that, hey, well, we did actually better than most other European countries.
Well, 1 year later, in Europe, Estonia's infection rate from the last 14 days is second only to Czechia. What this means is that the memes from last year that this virus can't spread that much in Estonia because, we don't hug or kiss that much and we just like to be more on our own. Well, it turns out, that didn't really have that much to do with reality. Just another theory as it goes in the COVID times. So how did this happen? And what really is the current situation here in Estonia? First of all, it's safe to say we had a fairly relaxed summer here. Most of the harsh restrictions were gone by midsummer, and so a lot of festivals and events could take place, even if the number of attendance was somewhat limited. Bars, clubs, and every other place that hadn't gone bankrupt were once again open, so they had the chance to make back some lost revenue. And also people had the chance to travel because Estonia had a very small infection rate. That meant that to most of the countries where there weren't any travel bans imposed, we could actually go there without any quarantine restrictions. By midsummer, it seemed that life was actually pretty much back to normal, even though every day still a couple of cases were ticking in the background. But we all knew that the second wave was just a matter of time. It wasn't if, it was when. As autumn rolled on, the number of COVID infections gradually started climbing, but nothing too serious. So the new measures that the government started imposing weren't actually that harsh. The government tried to keep things open as long as possible because that was the new mantra now here in Estonia. Let's keep the country open, the vaccines are soon going to come, so let's just keep fighting for a bit longer. Things started going south from more or less mid-October. Restrictions became gradually stricter, but were still fairly relaxed until the end of the year, when most public entertainment venues were once again shut down. And true enough, the numbers stabilized for a while, and remained around a sort of plateau until mid-February. But from mid-February, it's once again been an upward trend. By now, starting from last week, we're actually living with quite similar measures as we did back in last year's spring. They haven't declared an official state of emergency, but that's only because they've changed some legislation, so they don't really have to declare it, they can still react to the situation accordingly. These changes in the law that were passed last year made it easier for the government to impose specific restrictions and regulations during similar crises without having to make it an official state of emergency. So this means we've had the ability to react quicker, but as far as preventing the worst goes, then apparently it didn't really make that big of a difference. As you can imagine, there are a variety of viewpoints in the society that are quite contrasting, but how should we actually handle this whole situation? And there's still a lot of people who don't really consider it that big of a thing, even if the hospitals these days are close to losing control of the situation, if it hasn't already happened already in some of them, with the total number of hospitalized patients hovering around 700 these days. We don't know yet if this is the new peak, but it's likely that it shouldn't be far away now. Well, it certainly isn't irrelevant that we have a new government these days, and by now for already around 2 months, I'd say. And this one, unlike the previous one, doesn't include the local version of the neoconservative populists who occasionally like to flirt with far-right tendencies. The previous one actually collapsed due to a corruption scandal, and this meant that Kaja Kallas, the leader of Reform Party, like more this neoliberal party, had the chance to show that what she's capable of as our first female prime minister. To be fair, the Reform Party did win the last parliamentary elections, and in general they're not really big believers in big government, so it shouldn't have come as a surprise that they relieved a fair number of the restrictions not long after they came into power, emphasizing more that it's everyone's own responsibility and duty to make sure that the spread wouldn't get out of hand. So let's say that we took more or less a similar approach to what the Swedes did last year. I guess you can imagine what happened next. Like an anecdotal clockwork, basically exactly 2 weeks later, the case numbers started going up again. And the record so far is around 1,900, somewhere there, just a few days ago. And that's in a country with a population of 1.3 million. I'm not a scientist or anything, but it does seem to make sense that an airborne virus will spread more easily if different people spend more time together in various indoor public places, without proper masks or without properly using them. I mean, the last couple of months have been a pretty good case study for it. It didn't take too long for the government to realize that they might have messed up, or that they might have overestimated the intelligent and rational behavior of the Estonian citizens, because they started gradually adding new restrictions. But since the epidemic situation became worse way too fast, then starting from the 11th of March, we are now basically more or less in a lockdown once again. So this does pose the question that how did this happen again? I mean, we knew what we were fighting against, and we had a pretty good reference point from last spring. Perhaps we were a bit too optimistic, perhaps we've just become tired, or perhaps people's emotional reference points are completely worn out, so the everyday numbers of how many new infections there are just basically categorized in our brains as vague statistics. And keep in mind that most of us by now know someone who has had COVID-19, and a lot of us have had to self-isolate due to being in close contact with someone who's carrying the virus. There's also a certain feeling of absurdity, which is very much tied to bureaucracy, and that definitely plays part in this general atmosphere of I give up. And that leads to the question of vaccination and how that campaign is going on around here. We all knew that it was going to be a massive challenge, not only a healthcare one, but a logistical one, from upgrading our online systems to making sure that the lines of communication are set as they should be. And I have no doubt that there were a lot of people working for it, but just apparently not that successfully. The first shipment of the COVID vaccine arrived to Estonia on the 26th of December. It was the Pfizer-BioNTech vaccine. Almost 3 months later, taking into account that there are 3 COVID vaccines available here in Estonia, a total of around 90,000 people have had the first shot, and more than 50,000 have had 2 shots. The tempo has been inconsistent, which is quite common in Europe these days. But if you look at the numbers closer, then Estonia actually is doing pretty well if you compare it to most of the countries around us. The shipments tend to be either late or they're smaller than expected, and this has created quite a lot of chaos. Then there's the Valga case. In mid-January, the manager of a hospital in Valga, a small town in South Estonia, offered his fellow Rotary Club members the chance to get vaccinated before the general queue. Humorically enough, Margus Ulst, the hospital manager, was also a member of Reform Party. I mean, sure, the guy got whistleblowed by some of his fellow members, but a number of the members had already signed up and didn't seem to mind that this was completely off the record and just the manager of a hospital taking advantage of his position. Ulst lost his job in the hospital soon after, but it really wasn't a good start to the vaccination campaign, to say the least, and not really a good image for the Reform Party, who was just starting with the whole forming a new and better government thing with less corruption, although including Keskerakond as the coalition partners who were in the center of a corruption scandal that ended up with the previous government falling apart in the first place. Still, the vaccination is ticking on, and by now most of our healthcare workers, as well as our senior citizens or people in the elderly care facilities, are mostly vaccinated. But as the focus widens, the problems are becoming clearer and clearer. The systems in place to handle the schedules and logistics are certainly not reflecting our status as an IT state. Excel spreadsheets are still the name of the game, and people responsible for the big picture don't really have a clear track of what's going on, who is already vaccinated and who not, which GP centers have already gotten enough vaccine and which ones are still waiting. In theory, in an IT state like Estonia, people should be able to register for vaccination online, and that should be that. In reality, in a pilot test, the system turned out to be buggy and unreliable. While waiting for better systems or for the GP office to personally contact them and offer the vaccine, people are calling their GPs to ask if they could already get vaccinated, and sure enough, sometimes apparently that works. Mind you, even if you're not in the risk group, so not part of the people who should be prioritized. And as far as the IT systems are concerned, then they've been mostly developed independently and are not really that much compatible with each other. So this is just another example of how the cooperation between the public and private sector hasn't really been perfect, to say the least. The whole vaccination plan relies on trust, and that's certainly something that isn't in abundance these days. If you look at the European level, you can also see that this same mentality that every man for himself is spreading. So for example, there are countries that try to get extra vaccine doses by making separate deals. And the fact that the vaccination rate of the UK, for example, stands at 39 per 100 people, next to 24 in Malta and 18 in Hungary, who are the top two countries in the EU, well, I guess that will bring a satisfying grin to the faces of a number of Brexiteers and Eurosceptics. Add in the recent news regarding AstraZeneca, the suspicions about its side effects, and how countries like Germany, France, Italy, the Netherlands, Denmark, Norway, Iceland and others have stopped vaccinating people with the AstraZeneca vaccine, it shouldn't be too surprising why even people who usually have no problems with vaccines are becoming hesitant of the whole shenanigans. After all, this is the most important global vaccination campaign of the last decades. But it's clear it's definitely not going according to plan. And next to these decisive decisions from a growing number of countries, the encouraging words from the representatives of vaccine producers or medicine agencies about how AstraZeneca is completely safe does understandably ring a hollow bell for a lot of people. Here in Estonia, we're still using the AstraZeneca vaccine, though the official guidelines are that it isn't recommended for patients who have a medical condition that makes them prone to clotting. And I guess why we're still using it is because the situation here in Estonia is just too dire. We need all the vaccines we can get. The segregation situation is also not making things any easier, because, for example, for the local Russian minority, then they would prefer to have the vaccination with the Russian Sputnik vaccine, which Estonia is not using. And apparently they don't really trust the vaccines that we are using. So what next? We don't really know how this summer will play out, but we do have some sort of imagination that COVID should be still a fairly seasonal disease. Less time indoors and more time outdoors will certainly be something that will improve people's mental health that has been severely deteriorating throughout the last year. And perhaps especially in younger people who maybe tend to be more reliant on the charms and activities of the exterior world. And after all, the lack of personnel and resources in psychological help for children and the youth has been a problem for a long time. The pandemic has only made it worse. And there's also the whole question of education. What effect will this last year of largely remote learning have on the kids, and what this kind of gap will mean for them in the future? Perhaps not a lost generation, but a disorientated one, quite possibly. It's going to be a curious transition period these next months. After all, a lot of sectors are waiting to get back to business, and people as well are missing the good old ways. Even though I guess most of us remember how back in last spring there were these calls that we can't really go on with life how it used to be, we have to change things. Well, it seems that going back to the old ways by now is exactly what we would like to do, and you can't really blame people, can you? Taking this summer, for example, then another summer with no major events threatens to completely demolish the current infrastructure of the entertainment and cultural sector. And it's obviously not going to be limited to only one field. Tourism has been one of the main victims of the pandemic, so it's going to be interesting to see how it will adapt in the future. What I'm saying is that theoretically the Pink Pop Festival this year in Netherlands should take place. And Jean Frusciante should stand up on the stage along with Red Hot Chili Peppers. And theoretically I should be in the crowd as well. But maybe to be in the crowd I have to get vaccinated before. Perhaps that might become one of the prerequisites to take part in large public events and gatherings. But how will it affect our already torn and divided societies if we add another layer of exclusion into the formula, especially one as sensitive as vaccination apparently is? Well, the percentage of people immune, whether due to vaccination or having antibodies from already going through the disease, is increasing one way or the other. So there will come a moment when it will have a more distinctive impact on the spread of the virus as well. We're not there yet, and even though we're going through a rough patch here in Estonia, we can still at least comfort ourselves with the fact that the percentage of cases that have had a fatal ending have been relatively modest here, with only Denmark, Cyprus, Finland, Norway and Iceland having a lower death rate in the EU EEA. But since that table is topped by Czechia, as well as the table with the largest new case ratio from the last 14 days, where Estonia is second, then I guess we shouldn't be celebrating just yet. In conclusion, the total number of fatalities in the world stands currently at 2.6 million, with the total number of cases more than 120 million. We're still far away from the most modest estimate of the fatalities of the Spanish flu from 1918 until 1920. That number stands at around 17 million. So we should remind ourselves that things could be a lot worse if COVID-19's mortality rate would be higher. After all, we basically could take all of this as a kind of a test. And what this test has shown us is how helpless we largely are when we're facing global challenges like a pandemic. And even though this one is not over yet, I don't believe that most of us think that this is going to be the last one. So the question of how fast and how efficiently we will react to the next one remains as crucial as ever.